You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no one should be wearing a loose-fitting denture. We're talking about dental implants today, the newest, hottest thing in dentistry for replacing teeth. With us, we have an expert on the topic. We've had him on the program before, Dr. Tony Feck. Dr. Feck, welcome to the program.
Thank you for having me, Randy. It's great to be back.
Well, good. Now, before we get into the topic, I've got lots of questions. For people that don't know your practice, who's the typical patient? What are the different services you offer?
We do all types of general dentistry services, but the patient that seems to find me, probably from reputation from others, is the patient who is highly fearful or the patient who is interested in dental implants.
Now, since you were on the show before, what's changed with dental implants?
Oh my gosh, no other field in dentistry is evolving faster, and that's good. If you're out there, you're considering dental implants, then this is a very exciting time, because if you've been told one thing in the past, it's likely that that has changed.
I mean, people that weren't candidates a few years ago, as you say, may have been told they don't have enough bone, they could do it.
Yeah, not only have they been told they may not be good candidates because they don't have enough bone, and we've got dental implant systems, we've got techniques, we've got new ways to look at restoring someone's function. But also that dental implants used to be highly expensive, highly invasive, and the world of dental implantology has changed, and it's a great thing.
Now, you say things like, or at the top of the show, we said no more dentures. Nobody should be wearing a loose-fitting denture. Do you believe that?
I honestly believe it. People wear dentures by choice. Now, they may not know that. They may not know the choices they can make, but if you wear a denture, it's because you've chosen to wear a denture, because you have other choices you could make.
So nobody should be wearing a denture. Are there a lot? You're in Lexington, Kentucky. Are there a lot?
There are. It's one of the things
like thousands?
One of the things that I'm not as proud of as a Kentuckian is that Kentucky leads the nation in edentulous. In other words, people who don't have their natural teeth. And oftentimes they'll have this done at a very young age, and by the time that they are in their 40s or 50s or certainly in their 60s, then their mouth has changed as a result of not having teeth, and wearing a denture is a significant compromise to their quality of life.
So there's people that are in their 40s and 50s where you are that are wearing a denture?
It's amazing how many. Until I actually did the first episode on the Wellness Hour.
Yeah.
And by the way, thank you for what you do, because the information from the Wellness Hour I know is changing people's lives. I see it in Lexington, Kentucky, surrounding areas. It's got to be doing that all over the country.
Well, you told me way back then that people don't know their options.
They don't know their options.
It's news to them. Do you hear that when they come in from the show?
I hear it all the time. And they may see the show, and all of a sudden, a new idea is awakened in their mind, and they say, you know what? My life could be different. I could eat what I want. I could be comfortable when I eat. I could smile with confidence. And there are a lot of other things that people don't appreciate has changed as a result of being a denture wearer.
Now, so how old can you be to get?
There is no age limit. I mean, I've helped people. There's a gentleman that came in. He was 85 years old. He came in, and he was wearing overalls. And if you may be watching, you may not know what overalls were. But I mistakenly judged him as a result of his age and his appearance, and it made me realize that you are neither too old nor whatever your pathway in life is, you are still a candidate for what dental implants can do to make your life better. And he had fixed implants done and fixed teeth, the kind that stay in all the time. And he smiles all the time
now.
So
at 82 years old?
He was 85 years old.
Why would an 85-year-old want to do this?
It's when do you stop caring about the quality of your life? I mean, when is that? Is it 5 years before you think you're going to die? Is it the day before you're going to die? I think that is something that is a part of human nature. Okay, you want your life to be better, and you want what was taken away as a result of losing your teeth.
Well, if you're 85, lucky enough to be 85, right?
Right.
People are bringing you food. It's all about food.
It is.
Almost.
Yeah.
So they can eat, or they have to be delicate, or they can eat whatever?
No, they can eat whatever they want. And in many ways, they can eat things that they couldn't eat with their natural teeth.
Like nuts? They can eat...
They can eat nuts, they can eat corn on the cob, they can bite off sandwiches or pizza with their front teeth.
So chewy things, not a problem?
Chewy things are not a problem. If you think about it, and you're not a denture wearer, and neither am I, but and for that reason, we fully can appreciate this. But when you're a denture wearer and you go into a restaurant, you don't do what you and I do. You don't look at the menu and say, I want this because it would taste great. Yeah. You pick something that you can eat. And that's...
Is that what they tell you?
Yeah, absolutely, every day. When I ask them this simple question, what would having dental implants that work like real teeth, what would that mean to you? And I've heard things that have amazed me. Not only do they talk about what they have missed eating-wise, they talk about personal things. They talk about their romantic life. And there was a study done and published, and it said this: people who wear dentures don't kiss as much.
Yeah,
as
makes
people
sense.
who don't.
I mean, if you're 50, like you say, there's 50-year-olds, and you're wearing a denture and you're dating, it's like you got a little secret.
Yeah.
It's like, at what point do you tell them I have a denture?
Some people never
really
share that secret because there's a stigma associated to dentures, and there shouldn't be, but there's no question that what it does for your confidence, because you don't know if that denture is going to move. And when you eat, you don't know if food is going to get stuck underneath your denture. You don't know what it's going to do to your breath. And you don't know what the future holds. So just the lack of confidence and the lack of self-esteem can impact a denture wearer's view of their world.
Now, if dental implants, like giving people a full arch of teeth that either snap in, snap out, lock in, or a permanent set of teeth that don't come in and out, if it's so good, why aren't all the denture wearers doing this? There's tens of thousands, hundreds of thousands where, in Kentucky.
Yeah.
Why aren't they doing it? What's your take?
It's a great question, and I've often asked myself that. But, I think, first of all, they don't know. They don't realize when they have their denture, they think that that's the end of the road.
Because they don't go to the dentist anymore.
They don't go to the dentist anymore. They also have misconceptions about dental implants. They think that dental implants, number one, are scary. They think that it's a major surgery. It looks like a screw. Going to put that in my jawbone. So it's natural for them to feel anxious about it. And then the third thing is that they think that they're out of reach financially. And one of the great things about dental implants, Randy, is that they have become more affordable as they have advanced in their ability to help people.
Now, you're a guy. You teach dentists from all over the country and out of the country how to do dental implants. Does it cost more to go to a guy like you?
No.
At your level?
No, to me, that's no reason to charge more just because I have more experience than someone else, or just because I might have a knowledge base that someone doesn't have yet. To me, it's about helping people. So why don't all of the denture wearers come in for dental implants? One of the things is that in their past, their dental treatment experience is often involved a sequence of treatments. So it may be that they had a filling, maybe they had a crown, maybe the crown failed, maybe they had a root canal, then they had the tooth extracted. So the last thing they want is one more service that they have to do.
That's a lot of money too.
It's a lot that they have invested. Dental implants, because of the way they work, is the last service you'll ever have done in nearly every single case. It is the ultimate treatment that gives the implant wearer what they have strived for their entire life.
So it's like a third set of teeth in a way.
It can be a third set of teeth, but it's amazing how many people, believe that dental implants sound too good to be true.
Did they say that on the console?
Oh, yeah, they say it. They say, I listened to you speak about this on the Wellness Hour. I heard about you from a friend, and, I just didn't trust the process just because of my background in dentistry. So I had to come in and see for myself. And a lot of them, until we deliver their denture or their crown or whatever we're putting on their dental implants, still have that lingering doubt. And then they'll come back on follow-up, and they all say the same thing, Randy. And it's always, gosh, why did I wait so long? Why didn't I do this before? Because I lost a lot of time enjoying the benefits.
A lot of good years.
A lot of good years.
Now, the spouses, like one gets them done, and then a couple months later, the other one?
Yeah, it's funny how often that happens, because oftentimes couples, see the program, or they'll hear about the service, and the wife typically sends the husband in first, and if the husband survives, then she wants to do it as well. But after the initial consult, the wife also typically wants to say, okay, let's do this as a group.
Well, men are bad about it. I mean, we tend to put things off.
Yeah.
Do you have spouses? I think you told me that, where they're dragging their husbands in because the husband's complaining so much about their teeth?
Yeah, no,
they've had enough?
That's a very typical scenario.
Really?
Where, and I'm reminded, it actually worked the other way in this story, but I'm reminded of a woman who for literally years endured pain and endured embarrassment. And when someone tells you that story, you want to say, why would you do that? But you have to remind yourself, they do it because of all of the misinformation, really the ignorance, not knowing their options. And now all of a sudden, I have the ability to take someone and literally change their life. I mean,
is this also true? I mean, the way you do it quickly, where on the day of the procedure, they could actually come in with no teeth and walk out with teeth.
They can literally walk out with teeth the same day.
Is that common, or just every once in a while?
Oh, it happens all the time. Yeah, people, depending on their condition, and certainly an examination is going to be necessary, and you want that, can actually come in and have the implant placed and be able to wear teeth on their way out.
Is that right? How soon are they eating?
They're eating right away.
Do you hear a lot of eating stories?
Oh, I hear people say things like, I love grilling out in the backyard. Okay. And they're proud of their cooking, but it's for everyone else. It's not for them. And to be able to eat your own food after putting so much love
like ribs
into
and things like that? It doesn't matter?
Yeah, absolutely. Yeah. It's one of the pleasures of life that we take for granted.
And what about the people that have really bad gums, like bleeding gums, gum disease? Yeah. Can they do this or no?
They can. In fact, that's one of the main reasons why teeth are extracted and why dental implants are placed. So if you have gum disease, if you have symptoms of gum disease or have been told you do, then dental implants can be the answer, because once your teeth are out, gum disease goes away. You still have to take care of your implants, okay? But gum disease ultimately causes people to lose teeth. Dental implant solves that.
And it doesn't hurt that much, right? Because look, I know we have to put disclaimers and things like that about no pain.
Yeah.
But I guess it's not a real painful procedure. The bone doesn't have...
No. Bone doesn't have nerve innervation. Now, the gum tissue over top of it does, but nowadays, we don't have to do highly invasive procedures in order to place implants. In the old days, totally different story. Now, we can make either a small incision or no incision at all, so that the trauma from placing an implant is no more, many times, than doing a filling.
Okay, good. Now, sedation. You're big on sedation.
Yeah.
You teach other dentists sedation. And you say they almost have no memory of this in some cases.
No, sedation is the answer for a majority of people who want to have implants but are scared to have implants. Dentistry, Randy, let's face it, can be scary. I mean, people have had bad experiences. They've heard about other people's bad experiences.
Nobody wants to go to the dentist, for sure.
Nobody wants to go to the dentist. But with sedation, they can have comfortable, relaxed dental experiences with little or no memory the next day. I had this one patient who was, like a lot of people, just frightened to death of dentistry. And the thought of having a dental implant was just almost more than he could tolerate. And so we talked about the options. He wanted the dental implants, but he didn't know if he could put up with the procedure. We sedated him. Everything went beautifully. And literally, we called him that day after he got home just to check on him. And he said, I didn't know that dental experiences could be that great. And now he's a patient that refers all kinds of his friends in. And what I realize is that everybody is anxious to a certain degree. don't let fear stand in the way of you realizing the benefits of dental implantology.
So sedation. So you do IV sedation, oral sedation like a pill. And some people you even have to give a pill the night before?
Yes.
Or on the way in?
Yes.
There's people that are that afraid?
Yeah, no. People will take medication the night before to help them sleep better and to start the procedure. And then they'll take oral sedation the morning of the appointment. Once they arrive at the office, they might take some more oral medication until they're comfortable enough for us to put an IV in. And then we use IV medications after that.
So what do you think they like the most when it's all done? The fact that they could eat and chew, or that they have a good-looking smile now for the first time?
Yes. All of the above.
Really?
All of the above. I couldn't pick one more than the other, because both of those things are things that I hear all the time are life changers. They truly are life changers. And I know that is a trite, overused expression. I had a grandmother come in one time, and I asked her, why are you interested in dental implants? And she told a story about taking a picture with her granddaughter. And in the picture, you could see that the grandmother did not have back teeth. And she teared up telling the story, because I don't want my granddaughter to remember her grandma looking like that. So she was there basically because of the people that are in her life that she loves dearly, and she wants them to remember her differently.
Yeah, with a big smile.
With a big smile.
So these are FDA approved to be permanent teeth.
These are FDA
These can
approved.
last as long as you do.
Absolutely, and usually they are going to outlive you. Okay, but that's a long, healthy life, full of doing all the things that make life precious. Eating, smiling, loving.
Now, we should mention, because we get emails about this, insurance. Insurance doesn't really cover dental implants here in the U.S. I mean, it'll cover a small portion. Medicare, Medicaid does not cover it at all.
Correct.
What's the answer you have?
The answer is twofold. Number one is that we have financing options available.
Okay.
So we can more than likely help you make this more affordable.
Are people financing it in your
People
practice
are
every week?
financing it on a daily basis.
Okay.
Nearly everyone. It's rare that someone comes in that doesn't need some type of financial assistance, and that's okay, because this is a big thing in their life. The second thing is that when people are done, a lot of times they'll say something like this, is that this is one of the best investments I ever made. I even have people say, you didn't charge me enough because this is so valuable. I mean, you consider the things that we do spend money on, what's more valuable than your smile?
And you do it all right there. We should mention, I guess how it's normally done is you go to one place, like the surgeon that does the implant surgery. Mm-hmm. Then you go to another doctor that puts a tooth on top, and maybe somewhere else that does the imaging. Right. You have this concept where you do it all right there.
Yeah.
Is that, aside from convenience, what's the other benefit to the patient?
Well,
having one guy doing both parts.
Yeah, well, let's not undervalue convenience, because that is important. Because in the past, you're right. People have had to go one place to have the implant placed, maybe another place to have some type of secondary procedure, then a third place to have the actual work done to create the teeth. And it took a lot of time. It took more money. It took more procedures, which could cause more discomfort and downtime to people. You can have it all done. Like for instance, in our office, everything from the diagnosis to the treatment planning to the sedation, the implant placement, all of the work that ends in a tooth, a natural replacement for a tooth, can all be done in one place. So save time, save money, and save discomfort.
So these people headed to dentures, right? Yeah. I guess they know who they are. They have loose teeth. It hurts when they eat and chew. Same kind of thing. They can extract the teeth and give them a full arch of teeth.
Yep.
Supported by dental implants.
Supported by dental implants. All of that is doable, and it's done every single day. And easy kind of minimizes the value of it.
All right.
Let me just say this. It's easier than people almost always think it is. People always think that this is a big ordeal getting a dental implant. And it really isn't. Okay? Given what we can do now that we weren't able to do just a few years ago, we can literally give someone the benefits of dental implants in shorter time, less money, and less discomfort.
Now, they meet with you, most of the patients?
They meet with me. I meet all of the patients who I treat.
Is there a consultation fee?
No charge. Come in. We'll be happy to talk to you about it.
How soon can you tell somebody you're a candidate? We can do this.
Same day.
And are they still skeptical sometimes?
Yeah.
Are you sure? Do they ever question you? Are you sure?
Yeah, it is. I mean, but one of the great things that the Wellness Hour has done is it begins a trusting relationship, and hopefully when people come to our office, then they feel that we feel for them, and I do dentistry as a living, but I help people because of the passion that has come from doing things like sedation and dental implantology.
So for some people, it's just absolutely life-changing.
It is life-changing. One gentleman that we treated had his teeth taken out somewhere else and then had a conventional denture made. And if you don't appreciate dentures, if you don't realize how dentures work, they stay in by suction and the roof of the mouth and the upper denture is covered. So you don't feel your food, you don't taste it as well. And he gagged, and this gag reflex prevented him from wearing his denture. So he's, living his life
How old
without
was he?
any teeth. He's in his mid-30s.
Oh, wow.
He's got a young family, great guy. He comes in my office thinking that this isn't possible, that he can't afford dentures, that there's no solution for him. And then after a consultation, he learns his options. We make him the type of dentures that's lock in, top and bottom. The roof of the mouth isn't covered in the upper. And he's smiling and he's eating. And now he's a completely changed human being.
This was a guy that you said just didn't even wear his dentures? They were so bad?
He couldn't wear his
no
dentures.
teeth?
No, he
Really?
had a gag reflex. So just wearing the dentures
So
was
when
impossible.
he sees his face in the mirror, what's that like?
He said we gave his life back to him. And maybe that's saying too much, but you can't convince him otherwise.
So like you said earlier, some of them come in because they're in pain. They just want to be out of pain, but they end up with this beautiful smile. And they end up liking the compliments they get?
Oh, sure. No. People don't appreciate it. They'll come in and they'll say, I had this done and I did it for this reason. Maybe they did it so that they could eat more comfortably. But you know what? People are always saying to me now, they're saying, what have you done? Have you lost weight? Is that a new haircut? Have you got a new romance in your life? And they just kind of smile. And a lot of times they'll say, I'm just happier. Sometimes they'll say, it's my teeth, it's my smile, it's my dentist.
Now, I know a couple of denture wearers, right? They never complain. They seem to be fine. Are you saying there's no such thing as a happy denture wearer?
There are happy denture wearers, typically after they first get their denture. Okay, if they can tolerate it, then they're happy because it corrected a significant problem they had with their natural teeth. But over time, they become less happy. Now, what happens to a lot of denture wearers is they just get used to it. This just becomes the new normal. Okay. It's normal for me to not like my smile. It's normal for me to not look happy. It's normal for me to never, ever eat steak again. But they don't have to.
That all changes.
It all changes.
So I guess the challenge is just getting them, like people watching this. I'm sure there's people watching this that are saying, I don't know.
Yeah.
Maybe I'm too old.
Yeah.
Because you say 75, 80 is young in your practice. So they're not too old for that.
No, age is not going to affect the treatment that we do. Age is truly in your mind. And if you want better quality life, then what I hear from patients we help who are 70, 80, even older, is always, this is the best thing I've ever done.
Is that right?
And I wish I'd done it sooner.
Now we're just about out of time, but I want to ask you about these permanent teeth that don't come in and out. For people that it's not a snap in, snap out.
Nope.
Who's a candidate for that?
The people that are candidates for the kind of teeth that stay in all the time are basically the people who want that. In other words,
a little bit more money, but you get teeth that don't come in and out.
Yeah, it involves more implants. Okay, but you don't take these in and out. These will never end up in a glass beside the bed. Okay, and your partner or your friend or whomever are never going to see you take your teeth in and out.
And they look real.
Oh, they are as close as
So you
thing to
just brush
real.
them like regular teeth.
You brush them just like regular teeth.
And then maintenance, they just go
Yeah,
in.
you go to the dentist just like regular teeth. It's just like regular
Because
teeth.
that's what people want, teeth that don't come in and out. That seems like the easiest way to go.
A lot of people do not want to take their teeth in and out. I mean, they feel like that is artificial. And they want
How long have
natural.
you been a dentist? Over 30 years?
34 years.
34 years. Is this the happiest group of patients? The people that you give their teeth back with dental implants?
The reason I still practice dentistry, the reason why I am happier in my profession than I've ever been is because of what we can do to help people like the denture wearer or the patient who is highly fearful. And we can literally make the experience better than ever before. This is the best it's ever been right now.
Now we are out of time, but I want to thank you for coming on the show. But people need to know, and I'm not siding with you on this, I'm just asking the questions, but right there in Kentucky, in Lexington, you're kind of a pioneer in this field, teaching dentists from all over the country, and it doesn't cost more to go to a guy like you.
No, and again, I personally don't think it should. I think that what you pay for a dental implant is something that should reflect the value that you get from that dental implant, not the person who puts it in.
Okay, good, good. So eating, chewing, if you can't eat or chew, can't smile, then you need to see Dr. Feck.
Yeah, or if you just don't want to wear a denture anymore, you don't have to. No more dentures.
No more dentures. I want to thank you for coming on the show. Always a pleasure.
Appreciate that, Randy, for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.